Good afternoon, everyone. It's Thursday, middle of July. Can you believe it? And quite chilly here in Joburg. So today I want to talk about myofascial release. And in order to understand myofascial release, you need to understand what's fascia. So let's just look a little bit at defining fascia, and then we'll look a little bit more at why it's important and why we even need to release it. Okay, so fascia, for those of you that saw the post on Facebook advertising this talk, it's kind of like it was a web of tissue with lots and lots of strands. It's very fine. And so you could think of it almost as a spider's web. Lots and lots of fine strands that actually connect everything in the body. So fascia lies between the skin and the underlying muscle, but fascia also lies around the muscle bellies. It lies, muscle bellies are made up of lots of tiny little fascicles or bellies. It lies around those. And in fact, fascia goes, fascia goes all the way to line even the outside of the cells. So every single structure in the body is actually surrounded by fascia, which is a kind of connective tissue. And fascia then forms one continuous structure from top to toe, from head to tail, whichever species we're talking about. And so if we think about the spider's web analogy again, you know that if something touches that spider's web on one side, it's going to vibrate right the way through the entire web. And so the analogy with fascia is that I can have something happening in my head, but I can influence it by working on another part of my body, or alternatively, the problem might be in my back, but it's the pain that I'm feeling is actually in my bum. Okay, so the fascia is all interconnected and it forms a connective tissue matrix. So when we spoke about the cartilage and we spoke about joint supplements, so we went through that structure in the first part of joint supplements. I said that there's a matrix, and a matrix just means that we have some sort of a structure around which we have a medium in which we can have cells, we can have different chemicals, and so different things can occur within this matrix. So fascia is very much like it connects everything. It provides a matrix in which chemical reactions can occur and messages can be carried. So we may find some cells, we'll certainly find some chemistry, we'll certainly find some structures, because connective tissue does need to have some structure. So the most important thing about fascia is that it is in touch with everything. It is able to connect every single aspect of your body, muscles, nerves, tendons, ligaments, cells, right down to the cellular level. And it acts as a type of messaging system. And thirdly, it has the ability to move and to glide. And that's where we end up with problems in our body, is when that ability of the fascia to move and glide is compromised, we end up with a stickiness or an adhesion or something that needs to be attended to, because now our body is negatively affected by that constriction. So if we understand what fascia is, and we understand that fascia can get stuck, then we come to what started this conversation was a post that Regan put on about her dog Sable that was having a myofascial release treatment. And it says exactly what it is. I said fascia top to toe I started that it covers the muscles. So the prefix for muscle is myo, Myofascial, so muscular fascial release is really what the technique is. And it's a very gentle, non-painful technique that restores balance to the body. And what I really like about it when I'm working with my animal patients is the fact that it is gentle and non-invasive, and for the most part non-painful. However, we can get pain afterwards, and I'll go into that a little later in the talk. So it's also important to understand that fascia actually has 3 layers. It has a superficial layer, and when we are doing skin rolls on a dog and even on ourselves, we are working on that superficial layer of fascia. It then has a deeper layer. So as we move through the layers of muscle, like I said, fascia covers all the muscles, all the muscle fibers, all the muscle cells. We start moving into a deeper layer of fascia. And then there's a third layer, which is referred to as the dural layer. And for those of you that know anything about neurology and the brain, we talk about the dura mater is the membrane that covers the brain and the spinal cord. So when we talk about a dural layer, we're talking about the very deepest layer of fascia that then surrounds the nervous tissue and, in fact, the brain and the spinal cord. And in order to be really effective with a myofascial release technique, you need to be certain that you are actually connected to every single layer. So there are soft tissue techniques, and there are some techniques which are called myofascial release techniques, which in fact only work on the superficial or the top layer. And so this is not the kind of technique to which I'm referring. Myofascial release, in the way that we were taught, the course that we did, is it incorporates and engages all 3 layers of the fascia. And that's also where the benefit lie in terms of its efficacy. So it's a very, very gentle movement. So if I can give you a bit of maybe a comparison. So when we do massage on a dog, we identify a tight spot or a trigger point, and we use pressure and we use kneading and we use various techniques to release that pressure point or that trigger point. And what we are doing is, as a therapist, I am controlling that treatment, and I am saying that I want that end result. In contrast, when we work with myofascia, we have no control whatsoever. It's so gentle that if we're able to connect to all those layers as we have been taught, we are allowing the body to yield its secrets. So we're asking the body to surrender what is tight and what it has been holding on to and what it is keeping as a secret. So massage is about control, and I have an end result, and that's what I want. Myofascial release is about surrender and allowing the body to bring forward what it needs to release. So for some people, it's really difficult to perform myofascial release because we have a desire to manage. Okay, and if you are not able to understand that myofascial release is surrender, you're going to find it a difficult technique to master. In fact, I don't know if we ever master it. But why do we get those adhesions, and why have we got, why do we even need something like myofascial release? And the truth is that whether we are talking about trauma, whether we're talking about surgery, whether we're talking about inflammation, all of those things can cause a stickiness or an adhesion in the fascia. The more that becomes a pattern, or the more an animal or a person moves in a particular way, the more constricted and the tighter that fascia becomes. until eventually you actually have a painful spot. So we want to very gently and over time. So we're not going to necessarily release everything in one session. We're going to take time to release, because every time we release, we're faced with another layer and another layer and another layer. With people where we have got a really adept myofascial release practitioner, for those of you that don't know, and I'm going to go a little bit woo-woo here, but when we are traumatized, whether it's a car accident or whether it's emotional trauma, we store that trauma in our bodies. And if we don't have an adequate form of release, then that trauma stays in our body and it embeds itself in the fascia. And eventually it will express itself as a tight spot or a painful spot. So it makes sense then that when we are working with myofascia and we're asking for a release, we need to be aware that we may well get a release of emotional trauma as well. So we get it with people, and those human practitioners with whom I have worked often will refer those people. They'll have a counselor or someone on call to assist with that emotional trauma if and when it happens. It is possible with animals. We have gone down this route before, where I firmly believe that our animal companions have emotions, and I think we need to be particularly careful with dogs, for example, that come from a rescue background where we have no idea what psychological, emotional, and physical trauma they have undergone. That as a practitioner, we need to be very aware that we may actually get an emotional release. Having said that, dogs are really good at not necessarily storing stuff in their bodies. And how do they get rid of it? They shake it off. As humans, if we were able to learn to just shake it off and ignore it, I think that many of us would be in a better space emotionally than what we currently find ourselves. Having said that, dogs do still store some emotional trauma. But I digress now from we treat a lot of physical ailments. So if we have a dog that has had cruciate surgery, for example, we cut the skin, we cut through the joint capsule, we cut through soft tissue structures, and then that has to heal. And when it heals, it forms a scar, and the scar will impact on the fascia, and we will get an adhesion. So one of the areas where myofascial release really works is to work on the scar. But after an injury and after surgery, the dogs then start to move in a specific adjusted, compensated pattern. So they may shift their legs forward, their weight forward, they may shift to the opposite side back leg, it may be a combination, we may start getting tightness in the lumbar region. I mean, every dog is different, and our skills allow us to feel where those adhesions are. And so even when we're treating a dog and we're rehabilitating a dog and we want to get muscle strength, it is useful to do a few minutes of myofascial release over the scar area, for example, or over the tight area in the lumbar region, to release it, so that when we put our dogs into the underwater treadmill or when we ask them to exercise, we have freed up that adhesion and they are able to move in a more natural pattern. So it ties in with being a better therapist. Okay, so that's really myofascial release in a nutshell. What I want to say is that if we are working with a chronic problem, so old dogs with osteoarthritis that's developed over a number of years, and now, I mean, just imagine them now, it's been so damn cold. They're walking stiff, they're holding themselves. I mean, think about yourself in the cold. I mean, I'm making myself all tight because I'm so cold. My neck muscles and my muscles from my shoulders going up into the base of my skull are absolutely taut. I'm going to start to get adhesions there. If I undo them with a myofascial release technique, and especially the really, really chronic ones, I am in essence undoing the compensations that the dog has built up over time. And as a result of that, because they start to move in a new way after the myofascial release, and they are engaging perhaps some muscles, they're engaging them properly in a way that they haven't done for a long time, then we may actually get some pain after the session. So just be aware, although I say that it's a very gentle, non-painful method of releasing tensions and adhesions, depending on what happens afterwards and the extent of the release, we may well get pain a day or two after the treatment. And this is another thing, if you're working with someone who is skilled, they may say, look, I'm only doing this little section now. Please come back next week. I want to feel what this section feels like next week. I need your feedback. And then we'll move, if your dog will allow, we'll move to another section. And so we systematically work through the adhesions and the tightness and all of those areas that may be present in your dog's body. So that's pretty much what I have to say about myofascial release. I hope that you found it useful. I just want to scroll through some of the comments and see if there's any questions. Just bear with me a little. So, Regan, this is brilliant. Thank you, Tanya. Sable really has benefited tremendously from her sessions with Jess. And what's really interesting is Sable is quite a reactive dog. And we have found a technique which has allowed us and allowed Sable, it's allowed Sable to start to relax. And that's quite an incredible gift. And it's really amazing to be part of that and to witness it. So yeah, thanks, Regan. You gave me the idea for this talk, you and Sable. So I don't see any questions. I'm going to wrap it up. And I hope that, what I will do is there's a really interesting video. It's a whole lot of research that was done on fascia. It's called Strolling Under the Skin. I'm going to put the YouTube link onto this feed. So if you're interested in going to watch it, I really did find it fascinating in terms of what we don't understand about what occurs within our body and within indeed any mammal's body. So have a look for that, and please take the time. I think it's about 20 minutes. I really would recommend that you watch it. So thank you everyone for your attention and for your time. Stay warm, stay safe, and I will catch you next week. Same time, same place.